Welcome back, everybody, and welcome to Module 1, Topic 3, Key Terms of Morton College's Contact Tracer Program. In this topic, we will distinguish between quarantine and isolation, understand the difference between the infectious and incubation periods, define symptomatic, pre-symptomatic, and asymptomatic, and then also describe when it is safe for an individual to end quarantine or isolation. We're really going to be talking about a lot of main definitions in this topic. Our first two words, we have quarantine versus isolation. So it's really important to know that quarantine is a term used to keep someone who might have been exposed to COVID-19 away from others. So you're protecting those that don't know they're sick. They might be sick, they might not be sick, but they're not confirmed to have COVID-19. First, isolation is a term used to separate people who are infected with the virus from people who are not infected. So we isolate those who are positive for COVID-19. Our next two terms, we have the incubation period versus the infectious period. Now, an incubation period is just how it sounds. You're incubating. Something is brewing. It's kind of growing, so to speak. So the incubation period is the time from exposure to symptom onset. That means when your symptoms start. Research shows that this could be from 2 to 14 days, with an average presenting between 4 to 5 days from exposure. In a recent study, they found that 97.5% of people that were positive showed symptoms within 11.5 days. So you don't really know when those symptoms are going to be showing, but that's why that 2 to 14 day period is there, because it's the virus could be incubating, it could be kind of growing. Versus the infectious period. Now, the infectious period is the time when the infected person can transmit the virus to others. And this normally happens in a symptomatic person 48 hours prior to showing symptoms to possibly 10 days after showing symptoms. So let's say a person gets sick on Wednesday during the week. That means they started showing symptoms. So they're coughing, they have shortness of breath, they may have a fever. That means 2 days before Wednesday. So Monday that person was infectious. So from Monday to 10 days after Wednesday, that person could possibly be infectious, spreading the disease. There are some other terms. We have asymptomatic, which we've kind of been talking about. So asymptomatic, patients who are infected, but they never develop symptoms. Pre-symptomatic, patients who are infected, but have not yet developed symptoms. Pre-symptomatic spread can happen 48 hours prior to showing symptoms. So this is that 2 days before someone being sick, of that infectious period we just talked about. We say that it was a pre-symptomatic spread if someone spread the virus that way. And then symptomatic are patients who are infected that are displaying symptoms. So you have symptoms, you are symptomatic. Okay, so now we're going to get into a little bit more on quarantine. In my opinion, quarantine's a little bit more complicated than isolation. So the first thing is, who needs quarantine? So who is quarantine? We just talked about how quarantine is to protect those who may not be sick from those who are. So you need quarantine if you were within 6 feet of someone who has COVID-19 for at least 15 minutes. And that's with a mask, without a mask. You are within 6 feet of them. You provided care at home to someone who is sick with COVID-19. You had direct physical contact with the person. You touched them, you hugged them, you kissed them. You shared eating or drinking utensils, or they sneezed, coughed, or somehow got respiratory droplets on you. It's important to note here that this includes people who have already had COVID-19 or have had a positive antibody test. Even though you were already exposed to this virus and maybe overcome it, we don't have enough information yet that says you can't get it again. So at this time, the CDC is recommending that those people also quarantine if they had met any of these above 5 criteria. So then what should you do? So you quarantine. You stay home for 14 days after your last exposure with the person who had COVID. You want to watch for fever that's denoted as 100.4 degrees Fahrenheit, cough, shortness of breath, or any other symptoms on that symptom list we talked about in topic 1. And you want to stay away from people, and especially those who are at high risk for getting sick. The elderly, those who have underlying health conditions. And we're going to get more into that in the next module, but those are just a few examples for now. So then the question is, how long? How do you know? There's a variety of different scenarios that can arise. So scenario 1, you had contact with someone, but you no longer need to have contact with that person that is infected with COVID-19. So let's take a look at this example. If we look here, on Wednesday the 1st was the last close contact with that person, your quarantine would end 14 days later. So 1 plus 14 brings us to the 15th on that month. And if you start at noon, you end at noon. So it's whatever time that you started, that's the time you end. Another scenario is that you had close contact, but you live with this person, but fortunately you can stay away from them. So you can be in a separate room, you have your separate bathroom, you don't have to share any space with this person who is infected. In that case, the quarantine remains the same. So for example, that person started their home isolation on the 1st. You live with them, but you never have contact with them. Then the 15th is when you would end your quarantine. Scenario 3. You are going to have additional close contact with someone during quarantine. So let's look at this graph. So on Wednesday the 1st was the start of your first quarantine. But then on the 5th, you had additional contact, or possibly someone else got sick. So that means your quarantine then starts over those 14 days from the 5th. 5 plus 14 brings us to the 19th would then be the last day of your quarantine. So to kind of summarize that, whatever the last day you had contact with somebody that's positive for COVID-19, you then go 14 days after that. So you may have to restart your quarantine. Then scenario 4, you live with someone. They have COVID-19, but you cannot avoid close contact with them. So maybe you live in a 1-bedroom apartment. Maybe you're caring for someone who you have to have contact with. Your quarantine is dependent on the end of their isolation. And we're going to get to what isolation means on the next slide. But here's an example. So the sick person ends their isolation on the 9th, this red circle right here. That means 14 days from the 9th brings us to the 23rd is when you would end your quarantine. And that 14 days with quarantine is correlated to the possibility that it might take 14 days for those symptoms to develop. So this is your quarantine time. So a little bit more on isolation. Who needs to isolate? People who have had COVID-19. Remember, isolation is a term referred to people who actually are positive. Now, you can be positive with symptoms and you're able to recover at home, or you can have no symptoms, but you had a positive COVID-19 test. So some way you know you have this disease of COVID-19. So this is when you isolate. What should you do? You need to stay at home except to get medical care. Monitor your symptoms. If you have an emergency warning sign, you need to seek emergency medical care. Stay in a separate room from other household members if possible. Use a separate bathroom if possible. Avoid contact with other members of the household and pets. Don't share personal household items like cups and towels and utensils. And most recently, we know wear a cloth face covering when around other people if you're able to. If it's restricting your breathing and you can't breathe, that's obviously a different situation. But we now know that those cloth face coverings, all the research coming out is showing that it greatly reduces the spread. So when you're in your home, you should be wearing a mask. You should be wearing a mask at all times to protect those around you. And you're only leaving your house to get medical care. So when does isolation end? Isolation is more associated with the number 10 rather than 14. So if you think you had COVID and you had symptoms, you end your isolation at least 10 days since your symptoms first appeared. You want to have 24 hours have passed with no fever, without taking medication, and all your symptoms are improving. Whatever symptoms you have, they have to be improving. This is actually a recent change by the CDC. At first, it was 72 hours and not 24 hours, but now it's 24. Another possibility, you think or know you had COVID, but you were asymptomatic. Well, that's going to be 10 days after you have taken your positive test and you have no symptoms. So again, 10 days after your positive test with no symptoms. And then the last scenario, you could be immunocompromised. You want to follow your healthcare provider's advice. Most likely, your isolation will be longer than 10 days, and you may need to have 2 negative COVID tests proving that you no longer have this disease. Here are the resources if you need them. Go ahead and visit. All information was taken from the CDC, and as we know, there are constant updates on a daily basis. See you on the next module.